My name is Dr. Ralph Wilson. I grew up in Iowa, started in a small town in Boone, Iowa, moved to Marshalltown, which is another relatively small town. And from there I went to the University of Iowa for 7 years. Enjoyed my lifestyle in Iowa City. That's where I became initially enchanted with orthopedics because I was fortunate enough to have a mentor, Dr. Ponsetti, who was basically world famous in terms of clubfoot management. And as a medical student, I was able to work with him in research. And so he started me off on my enthusiasm for orthopedics, as well as some of the other fine orthopedists that were at Iowa City at that time. So I went to undergraduate in Iowa City, and then I went, after medical school, I stayed there for 4 more years and finished my medical school there. Then I went off to San Bernardino County Hospital, which turned out to be a wonderful opportunity because it was a county hospital and they had a general surgery and general medical program at which I was able to stay for 1 additional year, which kept me out of the military just long enough to get me into an orthopedic situation in the military. When I went to the military, they thought I was an orthopedist, even though I had no official formal training in orthopedics. So when I went to Vietnam, I was actually assigned to be the orthopedist in charge of a 400-bed hospital, even though I had no residency program. I don't know if that speaks highly of the Army or not, but that was the way I was sent to Vietnam. As it turned out, that hospital never was completed, and I did other things in Vietnam, but I got a nice start in orthopedics in the military and eventually went to Vanderbilt for my formal training. At Vanderbilt is a very didactic program, and I'd already done all the surgeries basically that any resident would do, but when I went to the residency program, I learned how to do them after the fact. So it was kind of a backward residency program for me, but it was a great program at Vanderbilt, and I had great mentors there as well. Well, I came to Arizona principally because I had interviewed with a gentleman in my practice when I was in a meeting in Memphis. But I had several friends that lived here. In fact, one of them I'd gone to medical school with and was also in Vietnam with me. And so he encouraged me to come to Arizona, and it worked out that there was a group in Mesa that had 3 people that needed a 4th. And it was a perfect fit for me. I hit the ground running. I was busy from the first day I started, and it was a really good match for my enthusiasm, and my wife was on board with Arizona as well, even though we never had lived here. So, well, I give my wife credit for the majority of our community involvement. She was on the school board for 16 years and eventually had a school named after her because of her involvement in that arena, and was then named Woman of the Year for Mesa about 18 years ago. But we've been involved in many facets of the community. She's been on many boards, even more boards than I have been on. I've been involved in the Rotary Club for the last 25 years, and it's been a good outlet for me to be a part of the involvement of the community. The Rotary Club here is very active in providing help to many agencies and organizations. Well, back in 1970, when I came here, I did the first joint replacement, the first total hip replacement. And at that point, I probably had an opportunity to become the joint person in the East Valley. I chose not to do that because I had had an enthusiasm for all aspects of orthopedics from the time I started my general practice internship program, and I didn't want to focus on one thing that I felt I might become bored with, and consequently kept a very general orthopedic practice. So partly because of the people I met in residency and in my medical school, I had enthusiasm for the spine and for the back, which are somewhat peripheral areas from the general orthopedist. But then I've continued to be enthusiastic about the whole spectrum of orthopedics, and it's been a nice fit for me because I enjoy a little bit of everything. Well, the time to come to the orthopedist is when you feel the need. And I see people that almost daily that have had something broken for a week and don't come in, or in fact they come in when they don't have anything broken. So for the patient to know when they're having enough problems to see the orthopedist is a tough call.